is Dr. Alfonso Ferguson. I'm a licensed professional counselor in the state of New Jersey. I'm also a licensed mental health counselor in the state of New York, as well as in the state of Florida. I own and operate my own private practice. It's called GoodWerk, and where I see clients from historically marginalized communities, that being Black and Brown folks or BIPOC folks, as well as folks who are on the LGBTQIA plus spectrum. So I think the needs vary, but I think on a larger scale, as it pertains to LGBTQ plus community, it's important for counselors to be mindful of, one, creating safety for the client to have like a range of their experience and being able to talk about it. Not relying on the client to educate you about the LGBTQ plus community and things like, whether it's like language, and I know language is always changing and evolving, but also as it pertains to their unique experiences from the community as a whole, but the client's unique experience, right? So I think I'm trying to say, but may not be saying very well, is it is important for counselors to do their homework, to come to the table with some kind of understanding or general knowledge. I do think that our clients are very open and willing to educate us, should there need be, on their own unique experiences and to some extent about the culture, but don't use the client as the sole source of information. And so I'm really intentional on making sure that out the gate, they get to be themselves. They get to let their guards down. They get to feel safe. They get to feel taken care of and supported in a very clinical manner, which is not normal for a lot of us within like the context of the world. You're the expert of your life, and I may be the expert on interventions and techniques, and I may have some experience based on the different clients that I see. And the goal is for us to work together to come up with solutions or support in the ways that are tailored and best fit you. As counselors, it may be important for us to be mindful of our own privileges, right? Our own privilege and how that shows up in the room and in the space, because I do believe our identities and our privilege kind of inform how we choose a conference, how we choose a workshop, how we choose to focus on certain CEUs or training experiences, because we're choosing based on our interests, but I think to some extent we're choosing based on our comfort. Right? You know, if I go into this particular training, I know it's going to require me to check my biases and check my privilege to some extent. So I'm not going to go to that workshop. I'm going to go to this other one that I'm an expert in, that I'm very comfortable about, that I know they won't challenge me here. So as a counselor, it may be important to begin to get comfortable with the uncomfortable, begin to get familiar with the unfamiliar.